Good morning. Well, thank you so much for the opportunity to speak with you today. Again, I'm Dr. Melissa Acquazzino, and I'm really happy to be here. I get the pleasure of running our survivorship clinic at Children's Hospital for our childhood cancer survivors, and this is a topic that I absolutely love to talk about. So today we're going to focus on the risk of cancer as adults in our childhood cancer survivors. I have no disclosures for the talk today. And again, we'll review both the risk of cancer in our adult survivors of childhood cancer, but also talk about some strategies and ways to reduce that risk and to adopt a healthier lifestyle. So to start, kind of to lay the foundation, we are seeing an increasing number of childhood cancer survivors, which is exciting. One of the big reasons that we're seeing more and more survivors is because we're improving our cure rates. So down here at the bottom, you can see that over time, we're seeing decreased mortality or improved cure for our childhood cancer patients. On the flip side, for reasons that aren't fully understood, we are seeing an increased number of childhood cancer patients over time. And those two factors work together to lead to increasing or growing numbers of childhood cancer survivors. So here in the United States, it's estimated that we have over 500,000 childhood cancer survivors alive and well. And these survivors are seeking care in a variety of settings, especially as they reach adulthood. So you can see there's kind of a continuum that we follow where our patients are diagnosed, they're treated by our pediatric oncology team, they're followed by our pediatric survivorship team that's very subspecialized and focused. But eventually they age out. They're now adults and too old for our pediatric team, and they transition into adult care. And there's several different options of where they can receive their medical care. And we'll kind of circle back to this concept at the end of the talk and some considerations for best care. In our growing number of childhood cancer survivors, unfortunately, late effects after treatment are common. And what late effects are is they are the medical complications, medical conditions that can develop as a direct result of the cancer treatment that the patient received. So we know that those treatments were necessary for cure, but that they can carry lifelong risk of medical complication. And unfortunately, again, these late effects are common. At least 2 out of 3 childhood cancer survivors will develop one or more therapy-related complications. And in these complications, at least 1 out of 4 are severe or life-threatening, so very impactful for our childhood cancer survivors. And we also know that the prevalence or the rate or number of complications in our childhood cancer survivors increase as our survivors age. And so this is a very important concept, a very important thing in adulthood. Unfortunately, these late effects or medical complications from treatment do contribute to a risk of death in our childhood cancer survivors. And we know that we see early mortality in our survivors of childhood cancer when we compare them to the general population. The most common reason for early mortality in our childhood cancer survivors is relapse of their primary disease. But the second most common reason is the focus of our talk today, and that's the development of another type of cancer down the road. And finally, in this category, we know that damage to the heart or the lungs can be a significant cause of early mortality in our survivors. This mortality risk is improving over time. So that's good news. Again, we're getting better at curing kids with cancer, and we have been over time able to decrease the toxicity of our cancer treatment, which is huge when we think of lifelong, long-term effects. So this figure is from a paper that was studying this very concept of early mortality in our childhood cancer survivors. And you can see highlighted on this top left The general population is in blue, that's their survival over time. And our childhood cancer survivors is projected in yellow. So you can see that there's this gap or discrepancy in survival. The gap or discrepancy that we see is improving as our treatments improve and become less toxic. So we look at this figure from the 70s versus the 80s versus the 90s, we are seeing improvement in this early mortality risk. And that is good news and very important. When we have an individual survivor in front of us, his or her risk is very individualized. It depends on exactly what cancer treatment that survivor received. So we know that radiation carries a specific a specific collection of late effects depending on the site of radiation and the dose. Radiation is actually a very crucial risk factor for this particular talk because it carries the highest risk of secondary malignancy or developing another cancer down the road compared to any of our other treatment modalities. But we do know that certain types of chemotherapy contribute to an increased risk of cancer down the road. And surgery and stem cell transplant have their particular late effects as well. And then contributing to this individualized risk of late effects are different aspects that are specific to the survivor. So that there are different risks depending on gender, depending on age of treatment, depending on other comorbid conditions, and also depending on the genetics of the patient. And we do have a slide thinking about that a little bit more in depth coming up in the presentation. But there are multiple factors unique to each survivor that contribute to the risk of developing these late effects, including a secondary cancer. So specifically, what is the risk of another cancer down the road in our childhood cancer survivors? Kind of taking all comers, when you look at childhood cancer survivors versus the general population, there's about a 6-time increased risk of developing another type of cancer down the road. And again, this risk depends on the exact treatment received and is even increased further above that 6 times risk in our patients that have received radiation therapy. This figure over here on the right highlights some different types of cancers that we can see as a second cancer due to radiation. These cancers occur in the radiation field, and for the vast majority, there's a dose-dependent response. So as the dose of radiation increases, the risk of developing a cancer increases. The only one this doesn't really hold true for is cancer of the thyroid. And then the last piece here is we know, as we've kind of already hit on in this presentation, that developing a second cancer down the road contributes to a shortened life expectancy for our childhood cancer survivors. So having the appropriate counseling for risk reduction, doing the appropriate screening, starting treatment right away with a new diagnosis is so important to improve outcomes. So what can be done? What can I do? What can my patients do to lower the risk of a second cancer? There's multiple different things. We'll kind of go through them one by one. So the first is to avoid cancer promoting habits. And the big ones here are avoiding the use of tobacco, avoiding exposure to secondhand smoke, kind of underneath that tobacco umbrella, and then sun protection. So sunscreen, sun hats, sun shirts, shade, whatever it is, but avoiding the sunburn and that risk of a secondary skin cancer. The second item here, which definitely again falls under kind of a healthy lifestyle category, is to drink alcohol only in moderation. And the reason for this recommendation is that heavy drinking has been linked to developing various types of cancer. The third item here has to do with a healthy diet. This is something all of us can benefit from, but it is very impactful in our childhood cancer survivors and contributes to reduced risk of secondary cancers, as well as improved metabolic and heart health, et cetera. There's a ton of benefits. So the reason for this recommendation in terms of preventing another cancer down the road is we know that high intake of dietary fat has been linked to some cancers. We know that taking in good dietary fiber and vegetable intake can be protective. And we know that some preservatives are linked to cancer development. For our fourth item here, we have only a very few vaccines that prevent cancer, but the two that do are hepatitis B vaccine and our human papillomavirus vaccine or HPV vaccine do prevent cancer. And so we recommend these vaccines highly to our childhood cancer survivors. The fifth item here is we recommend that our childhood cancer survivors are seen for their annual physical. And while this may sound simple, it really means if they've identified a primary care provider that they have a medical home, they have a place to go if issues come up, they're getting the routine screening for cancer that's recommended for all the population. That is important for everyone, but is incredibly important in our childhood cancer survivors that are at higher risk of developing another cancer down the road. And then this having a primary care provider and getting your annual physical is so helpful for overall health as well. So looking at the variety of late effects that we can see in our childhood cancer survivors, this one helps with all of them. So monitoring for hypertension, high cholesterol, talking about healthy weight, all of those things are so important when we think of the variety of late effects that we can see in our survivors in addition to secondary cancers. And finally, number 6 on this slide is something that we're going to cover more in depth in upcoming slides, but there are screening recommendations available for our childhood cancer survivors specifically that address this increased risk of secondary malignancy, and we will talk about that. So going back to these first 3, they really highlight the importance of a healthy lifestyle in our survivors. And so I'm going to go through some places that I think have some great resources that can help in this area. So first, our Children's Oncology Group, or COG, is our international consortium that we conduct our clinical treatment trials through that make our fantastic survivorship recommendations. They're really important for the treatment of kids with cancer, and they have come out with these patient health links or patient education handouts that address a wide variety of topics. There's quite a few of them in multiple languages in the area of survivorship. But I highlighted these 2 because I think they're very pertinent to our talk today. The first is staying healthy through diet and physical activity. And the second is reducing the risk of second cancer. So some really important information. And these are available to anyone through the website here, available to download and print and distribute or to direct your patients to. Another society that's put out some really good resources for our survivors is the American Cancer Society. And on their website, they have a specific section entitled Living Well After Cancer Treatment and really have some fantastic information on healthy diet and healthy physical activity practices. And the final bullet point where they're looking at frequently asked questions, they actually really dive into the medical literature, the science, what's been published, what we know, and kind of digest it and summarize it in a way that's very accessible to our patients and their families. Another society that's done a great job with putting great information out there is the American Society of Clinical Oncology, or ASCO. And through their website at cancer.net, they have looked at, again, healthy living after cancer and a lot of information about nutrition, about exercise, about physical activity. So this website is another great place with many helpful resources for healthy living. Finally, the Leukemia and Lymphoma Society is a great place for resources. Their information is definitely targeted at survivors of either leukemia or lymphoma, but actually, leukemia and lymphoma are two of the most common diseases that we treat in children with cancer. And I do think their resources could be applicable regardless of the cancer diagnosis. There's a lot of great information there. They put out a survivor workbook that is free and downloadable, and they actually have separate ones for kids, young adults, and adults. So very cool, very age appropriate. And there's actually a variety of information in there. There's some blank worksheets that they can fill out, and it's very interactive, but there's definitely material throughout that survivor workbook that is very helpful for thinking about a healthy lifestyle. And they have some mental health support and exercises and resources, which is super important. In addition to the workbook, on their website, they have other ways to share information. So they have videos, podcasts, online chat forums. And I actually saw a link for free nutrition consults, which I thought was really cool, as that is a really big component in a healthy lifestyle after cancer treatment. So finally, focusing a bit on number 6, on getting the appropriate screening, the Children's Oncology Group puts out long-term follow-up guidelines, which are meant to direct the care of childhood cancer survivors. And they're very evidence-based. They're updated frequently. Right now, we're on version 5. Version 6 will come out next year. But these guidelines, while lengthy, it's a large PDF, 230 pages. It's very, very good, and it's available to everyone. This is a screenshot from one of the pages of the guidelines that's very pertinent to our talk today. So the guidelines are broken up by treatment exposure because the risk of late effects directly relates to the treatment that was received as a child as part of the cancer treatment. And so you can see that for patients that received radiation, the site of radiation is very important to determine what risks are present. And so for patients that received radiation to the abdomen, there is always a risk of colorectal cancer or developing another malignancy down the road. And there are screening recommendations available based on evidence to help with this risk. And so you can see that screening for colorectal cancer in our childhood cancer survivors that received radiation is recommended to start at a much younger age, at age 30, compared to the general population. And so this is really important that our childhood cancer survivors that received radiation to the abdomen for Wilms tumor, other tumors, that they're getting this early colorectal screening. We also have screening recommendations for females that received radiation to the chest as part of their Hodgkin lymphoma treatment, Ewing sarcoma treatment, etc. So radiation to the chest, we worry about breast cancer, and we know that early screening is important. So screening is recommended to start as young as age 25, as long as it's been at least 8 years from the radiation. And early screening is important. Screening with MRI is important in this population. And this is an area where they're actually doing clinical trials looking at, in addition to screening, what else can we do to reduce risk for these females? And there's an ongoing clinical trial with tamoxifen for risk reduction, as well as prophylactic mastectomy as an option in these patients to reduce risk. How does genetics play a role in thinking about risk of a secondary cancer in our childhood cancer survivors? And the answer is it depends, but we're thinking about this more and more. Honestly, historically, we used to think we don't know why kids get cancer, and it's probably really, really, really bad luck, for lack of a better explanation. But we now know that if we take a good history, if we're thoughtful, and if we test appropriately, that we are going to find an underlying genetic reason, or a cancer predisposition syndrome, a reason why this child developed the first cancer that they did. And if there is that underlying genetic reason throughout the body, odds are that patient is at risk for future cancers down the road. And we may know based on the genetic mutation what they are at risk for. And if we're able to define that, good screening guidelines exist to tell us, hey, we need to do this type of screening starting at this age, and here's why, here's the risk. So we can really make a difference if we're asking the right questions and finding those answers. And so for my patients that have a certain diagnosis, such as something that maybe is very rare, like adrenal cortical carcinoma, or something like rhabdomyosarcoma that isn't quite as rare, but we've been finding has a higher association with these genetic cancer predisposition syndromes, those patients I'll refer for genetic counseling, a full family history, and consideration of testing. Also, if my patient has cancer, even if the cancer type itself doesn't trigger this sort of thought process, if the family history is very significant, if there's been lots of cancers in the family, then I will refer for this genetic counseling and decision about genetic testing. And it's always a discussion with the patient and the family. Genetic testing has cost, has ramifications. We want to talk that through, the pluses and the minuses, but I've had really good success with referring to the hereditary cancer clinic through UNMC and the Monroe Meyer Institute. You can see they have a lot of different sites, including some outreach sites. And I have sent my patients and their families there, and I've had really good luck in trying to figure out whether there's something underlying in the genetics that will also contribute to the risk of another cancer down the road. Unfortunately, we know that many of our childhood cancer survivors are not getting the appropriate screening, and this is a really big deal to us. We know that this impacts outcomes, quality of life, length of life. So, kind of looking broadly at our childhood cancer survivor population, we know that the percentage that are receiving the appropriate screening and survivorship-based care decreases the further away they get from us. So the further along they get into their adult care, the less likely they are that they're getting these focused recommendations as a childhood cancer survivor. There's a really large childhood cancer survivorship study, that CCSS, that studied thousands and thousands of survivors. And they looked at this issue and found out that really, about 1 in 3 were receiving any sort of survivor-focused care, and only about 1 in 5 were getting counseled on risk reduction and appropriate screening to reduce the risk of a secondary cancer in the future. So this just really highlights how important it is that our childhood cancer survivors have a good plan in place. Often that's developed by us before they transition into the adult world, but they need to carry it with them and present that to their new providers they meet down the road, so that they can be receiving the appropriate screening lifelong. One place where we know that this happens really well is Nebraska Medicine has an adult survivor of childhood cancer clinic. So this clinic is very specialized, very up to date, does a fantastic job of making sure that our childhood cancer survivors are getting the appropriate medical care as adults and the appropriate screening and risk reduction counseling for that increased risk of cancer as an adult. And again, this clinic team does have multiple provider sites, and we refer all of our childhood cancer survivors that are willing to travel to one of these sites annually to this clinic, because we think it has huge benefit for our childhood cancer survivors. So that is all I have, and now we have time for questions. Thank you.